Hello, fellow 473 classmates. My name's Mary Nelson, and today I'm going to present to you on hemispatial neglect. What is hemispatial neglect? Well, we read about it in Chapter 6 of Ramachandran as the profound indifference to objects and events on a specific side of our world. It's also referred to as unilateral visual spatial neglect, or hemi-neglect, and visual inattention. The most common cause is stroke, but it can also happen as a result of head lesion, traumatic brain injuries, or other damage to the head. Now, when a stroke occurs, it most commonly occurs in the right parietal lobe. This is how Ramachandran describes why the patient that he talks about, Ellen, is neglecting things to the left side of her world. As we talked about, the two sides of the brain have different duties. They do things differently. And the right side of the brain, the right hemisphere, is responsible for the left side of the body, and the left hemisphere responsible for the right side of the body. This is referred to as contralateral or contralesional neglect, meaning that the neglect occurs on the opposite side of the damage to the brain. Neglect can occur as a result of the left hemisphere damage, but it presents a little differently. This neglect will result in stimulus or object-centered neglect rather than viewer-centered neglect, as it is when you have damage to the right side. Ellen, without having her attention drawn to the left side of her field, is not attending to it. She's not eating the food on her left side of her plate. She's not brushing the left side of her hair. And this is due to her damage being in her right inferior parietal lobe. So why right parietal damage? Well, let's talk about the right and the left brain. The right brain, the right hemisphere, processes things in a very holistic way. And the searchlight of the right hemisphere is very broad. It encompasses both the left and the right side of our visual world. However, the left side, the left hemisphere, really only attends to the right. And this is because the left is more sequential and analytical about its processes. This probably is why the left is referred to as the logical side, and the right referred to as the emotional side. Now, the parietal and the temporal lobes have specific duties, as we've talked about. Parietal lobe is the how pathway. The how pathway goes to the parietal lobes, and that discerns spatial layout, where we are in our external world in relation to objects around us, and it allows us to navigate our space. While the temporal lobes, which is where the what pathway is going to, it's concerned with recognizing and naming individual objects and responding to them with the appropriate emotions. So, the right brain responsible for the left brain responsible for the right, and the right having the broader outlook, when damage is occurred in the right parietal lobe, it's not able to be, that deficit is not able to be picked up by the left, as the left is only attending to the right. This is why the left side of the visual field is neglected. All of this is simply the tip of the iceberg when it comes to hemispatial neglect. There's so much to learn about it, and so many different studies that have been done. So I really wanted to just hone in on a few select things that are really important, I think, about the diagnosis and treatment of hemispatial neglect. The diagnosis is quite simple, but it does need to be very strategic and to the point. There are different tasks that therapists will have patients do. Common one is line bisection task, which is where they have a line on a page that's horizontal, and they ask the patient to bisect it in the middle with a vertical line. Commonly, patients with hemispatial neglect will put that middle line far to the right, as they're not seeing the left side of the line, so that, in their visual field, is the middle. The most common and most accurate task is labeled the cancellation task. This encompasses having a bunch of symbols or letters or numbers on a page and asking the patient to cancel out or cross out a very specific number, letter, or symbol. For example, if you had a page with the alphabet on it, all the different letters scattered across the page, and you asked the patient to cross out all of the E's. Now, this is so accurate as it's causing the patients to scan their entire visual field when they're looking at this page of letters or symbols or whatever it is. However, for a complete assessment, the assessor or the therapist should give a combination of the tasks and look at all the types of the presentations of the neglect, including asking family members about the changing behaviors of the client, of the patient, especially if it's a stroke that's caused the damage. Treatment, I found two main types that have been effective and have great efficacy in various studies done over the years. The first is labeled limb activation, and this essentially requires having the patient use the limbs on the neglected side. And this may be just when they're getting ready in the morning, making sure that they use those limbs first, things along those lines. However, the most common is visual scanning therapy, or VST. This aims to improve the visual scanning behavior of the patient by encouraging them to actively and consciously pay attention to stimuli on the affected side. So, for Ellen, it would be the left. Now, this only works if it's more intensive. It needs to be intensive, up to an hour a day for several weeks, maybe even months. However, this gets us into the prognosis of hemispatial neglect. Most often, several patients recover spontaneously, up to 6 weeks or 6 months following the experience of their brain damage. However, there are select patients who continue to experience these symptoms long term, and that's why these treatments are really important, and I think why they've been investigated, because the quality of life is severely impacted by these people who suffer from this neglect. Can you imagine walking around and not noticing things that are on your left side, stubbing your left toe repeatedly, bumping into different things, forgetting to brush the left side of your head? The list goes on and on. And so these treatments are really focused on behavioral interventions to help these people improve their quality of life as they work through the damage that has been occurred upon their brain. So, in a nutshell, that's hemispatial neglect for you. I'd love to talk longer, but I only have a limited amount of time. So, come to class on Tuesday and you'll get to hear a little bit more about the details and the nitty-gritty of hemispatial neglect that make it so interesting. Thanks for watching.